Everyone, I'm Governor John Carney. Thank you for joining us for our weekly press conference on Delaware's response to COVID-19. Once again, we're joined today by the Director of the Division of Public Health, Dr. Carol Rattay. Thanks, Dr. Rattay, for being with us and obviously for the tremendous work of your team. AJ Shaw, who looks like he's out on the road today. AJ, the Director of the Delaware Emergency Management Agency, got his hands full with the big vaccination site at Dover Downs Speedway this week. We appreciate his good work. And of course, Pam, who's our sign language expert for the hard of the deaf and hard of hearing community. Today, we're remembering the 1,379 Delawareans who've passed from COVID-19. The milestone nationally was 500,000 Americans who have died of COVID-19. We are remembering those who died, those we've lost, our family members, our friends, by flying our flags at half staff here in Delaware and across the country. We think about all those family members affected by this terrible disease, those who died and those who were sickened and those whose lives have been affected, those whose businesses have been interrupted and those who've lost their businesses. And today we pause to pray for those who have died, to remember them, and to redouble our efforts to make sure that we do them honor by flattening the curve, by following the public health guidance, by getting our children back in school, by getting our economy back moving again, and all these things we're focusing on and trying to strike the right balance between the health of our community and the strength of our economy here in Delaware, recognizing that it's not an either or proposition. It has to be both and that's been our focus from the beginning. And so today we remember those that we've lost. We pray for them and their families, and we think about them often. We do have a number of reports to make today on testing, on the status. We've got some really exciting news about the number of Delaware students are in schools, public and private schools across our state for in-person instruction, about 77,000 of them, and we thank the teachers and all those who are making that happen. We'll look at the data and see that the conditions on the ground in our state are getting better. We're getting healthier. The spread of the virus is going down. Not where we want it to be for sure, but headed in the right direction. We've opened up some of our business establishments to 50% of their fire code capacity indoors, and we are also, advocating for continued following of the public health guidance around mask wearing and social distancing. As I circulate, I see tremendous compliance around those requirements. Testing continues to go strong, AJ. I noticed, and you'll report more about it, we had our White House call with Jeff Zients and his team in the White House, and I heard other governors talk about concerns and issues that they have with testing. It's such a comfort to know that our testing operation is strong, continues to put up big numbers so that we know where the spread of the virus is here in our state. And AJ's team is doing a tremendous job. I mentioned schools. All the districts have some level of in-person instruction, so they're in the hybrid stage. We are vaccinating educators and teachers, and I want to have a big shout out to the school nurses who have been doing an incredible job with contact tracing in their school environments when they get a positive case, and tracking down who those folks, who those students or teachers have come in contact with. I met several of our school nurses at the Department of Education vaccination clinic at Dickinson High School on last Friday. Met a lot of the educators who came through, targeting some of the senior teachers, those with pre-existing health conditions, and our school nurses were there helping with the clinic at Dickinson. Just really exciting to see that. Overall, we've vaccinated about 4,000 teachers in a partnership with Albertsons pharmacies, and really good partner, and they were there in force delivering the vaccines. I want to thank Darrell Green and his team at Red Clay for that particular clinic and all the others that we've had. And I just one more shout out to the school nurses who've been doing a fantastic job and very helpful at the vaccination clinics as well. We've also started, as I said, to vaccinate child care providers, and we've done about 500 of those, and we'll continue to do that. Our overall objective for vaccination is what we call fast and fair, a term that I borrowed from my good friend, Governor Cooper down in North Carolina, and two words kind of explains our approach to getting out as many vaccines, as many needles into people's arms as we can, as fast as we can, and as equitably as we can. And so we have a number of things coming together to take vaccination clinics into communities, particularly communities of color. Dr. Rattay is going to talk about some of those efforts, a whole series of ways that we're doing that outreach, and want to thank Dr. Coker and others who are helping with that outreach, our federally qualified health centers who are getting allocation to do the same, our large vaccination clinics in each of the counties, the curative runs, and the community organizations that we're partnering with. We also have at least 5 state public health teams that are going out to see those seniors that are most difficult, most vulnerable in high-rise communities and remote communities in Newcastle County, the city of Wilmington, Kent County, and Sussex County as well. We'll continue to ramp that up. Already we're seeing higher numbers on the data dashboard with respect to our goals for equity, which is a big priority for all of us. So let's move from there to the data. And you can see again here from these numbers that we're getting healthier. We're still not where we need to be. Our positive tests on a 7-day moving average now is below the target of 5%, just slightly below it. We're down to 272 new cases each day on the 7-day moving average. We want to be better than that. When in the low point during the summer, obviously we were below 100, and of course that's one of the objectives that we have. We're under 200 and have been for several days now with respect to hospitalizations at 181. And again, sadly, as we started out with 1,379 Delawareans who've lost their life to COVID-19. Testing, as I said, continues to be robust. We've lost a few days, AJ, with the weather, but they bounce right back with a 5,000 test day, a 7,000 test day, and on course to be well over 100,000 and into the 150,000 and more range. A total of almost 618,000 total Delawareans. So we're moving in on the 974,000 or thereabouts population of our state, and we've done almost 1.4 million tests. So multiple Delawareans who've received more than one test. I talked about vaccinations, fast and fair. We're among the top states in the country in terms of the number of doses that we've administered. These numbers at 182,000 include both the federal program and the COVID-19 vaccines that come through the state. You can see the federal pharmacy program there at 38,000. That includes the nursing home contingent mostly, and additional doses that are now coming to the state directly to Walgreens. As you can see, over 190,000 doses that have been delivered to the state and 182,000 put in people's arms. We do have, because we didn't get our deliveries last week because of the weather. We have more that are waiting to be dispatched and moved to our partners and into our clinics than normally would be the case. That number was down around 10,000 and less just a week or two ago. So let's take a look at the rate of positive cases. You can see in each of the demographic groups, the younger adults continue to have the highest infection rates, and all of them are starting to flatten out, which of course is the objective. The next slide shows very well the peak in the spring, the better days over the summer, as people moved outdoors, as we flattened the curve, had fewer cases. Our hospitalizations, of course, went down as low as 29, and now we're at several times that at 181, but down from a peak of 474 just a little over a month ago. So you can see that peak very well in the graph and how we're flattening the curve basically in each of the data points. I mentioned at the top our partnership with FEMA. This is a federal agency, a great partnership between the state of Delaware and the Federal Emergency Management Agency, AJ's colleagues at the federal level who have set up this vaccination clinic at Dover Downs International Speedway. It's really a great opportunity for us to fulfill our second dose obligation to Delawareans that received their first dose 3 weeks to 4 weeks, a little over a month ago at the DMV facilities in Delaware City and in Georgetown. And so we did about 1,500 yesterday, or the day before, I should say, 3,000 second dose vaccinations each day for the rest of the week. And we do have some open appointments that Dr. Rattay and AJ are going to talk about later in this presentation. I mentioned vaccinating educators and school staff. Again, want to thank the Department of Education and their team for setting up these clinics. I attended one at John Dickinson High School on Friday. It went very smoothly. We're working in partnership with Albertsons pharmacies, as I said, which include the pharmacies in our Safeways, our Acme's, and other stores in our state. And it just gives an extra level of comfort for that school and school environments are safe places as we move more children back into school for in-person instruction. Our goal, as I said, with vaccination is fast and fair. Our effort to move as many of the vaccines that are allocated to Delaware into people's arms as quickly as possible, meet our second dose obligation 21 days or 28 days down the road, hopefully no more than 35 days. And for those of you who haven't gotten your second dose and are passing those milestones, look for opportunities, one coming that we'll talk about later in terms of additional appointments that we have at the Dover Downs event. So fast and fair. We've got lots of outreach going on into our communities of color across our state, including what we call the Vax Machine. And this is a partnership with CarePort MD, taking vaccines into the community and hopefully providing another mechanism for getting more difficult populations to get vaccinated. We have a clinic happening at Rose Hill Community Center. Already people have signed up for that clinic. I want to thank Rose Hill, Representative Cook, and others who've helped sign up members of the public to get this life-saving vaccine. We'll find other opportunities, and we have other opportunities scheduled to use the Vax Machine and get out into communities taking the vaccine to those to achieve our goal of equity and fair and fast distribution of this life-saving vaccine. And so keep your eye on and your ear out for those calls that you might receive from community leaders and elected officials and others to sign up and register for our community events. There'll be more about those as we get the supply. It's really a question of supply at this point. There'll be some more talk about the possibility of, and we had some discussion on our White House call earlier today on the imminent approval, hopefully, of the one-dose Johnson & Johnson vaccine. That'll tremendously help our efforts to get people vaccinated. It's just one dose with significant efficacy in terms of preventing deaths and hospitalizations, which is the overall objective. Obviously, and just another, we've been advised that there's a small amount of supply initially that will be distributed, something like 2 million doses. And so as we'll be getting just a fraction of that, but every additional dose helps as we try to get more people vaccinated in a fair and fast way. With that, I'm going to turn it over to Dr. Rattay. Thank her once again for her tremendous leadership, the work of her people at the Division of Public Health, Dr. Hong, Dr. Pescatore, all the way down the line. We appreciate their good work. Dr. Rattay.
Thank you so much, Governor. So let me move to the first slide where we're going to look at areas of concern. And you can see we don't have a lot of zip codes highlighted this week, which is really great news. And in fact, I moved the criteria for selecting zip codes of concern back to the criteria we used earlier in the fall. If we look back over the last few weeks, just 3 weeks ago, 47 zip codes would have met that criteria. 2 weeks ago, it was 7 zip codes. It went up a little last week to 27, but as you can see now, there's really just 6 zip codes that had a case rate of 250 per 100,000 people or above, and percent positive of 15 or above. So, and really, I should add, there's no real pattern that we're seeing. We've got the Hockessin area, 19711 in Newark, as well as Magnolia, Felton, Harrington, and Selbyville. So of course, we'll keep an eye on this and we'll keep letting you know, but overall the news is good news in that we're seeing less cases in Delaware at this point. As far as vaccines, as of today, our tracker says we've got 182,000 doses administered. And as of yesterday morning, the breakdown for that was 129,000 first doses and 50,000 second doses. And of course, those second dose numbers are going to go up pretty significantly this week with the FEMA events. I also wanted to make a mention about the wait list. As you recall, on January 20th, we set up a wait list for individuals 65 and older. There have been a total of 123,000 individuals, so Delaware seniors, on that wait list. And among those, 50,000 have received their vaccine. So we still have about 73,000 who are yet to receive their first vaccine. Of those that have received their first vaccine previously, many of those are now receiving their second vaccine. So at this point, about 40% of people on the wait list have received their first vaccine. So we're going to keep focusing as soon as we get over the hump of some of these second doses to get more people invited to vaccine opportunities for their first dose. As the governor mentioned, we've been working hard on addressing equity in our state. It is a priority for all of us to make sure that vaccination is distributed equitably with regards to all communities in our state. This is something we've been working on hard, and we've made a lot of progress, but we really feel we have gotten to a point of more formalizing a plan, a multifaceted and comprehensive plan to make it easier for people to get the vaccine, especially for people who aren't likely to go to some of these more mass vaccination, these large vaccination events for a variety of reasons. So the 5 pathways that we want to highlight to the vaccine include federally qualified health centers. These federally qualified health centers that we have in our state play an important role in serving our populations, especially our higher risk, lower income Delawareans. We have 3 awesome federally qualified health centers in our state. La Red is in Sussex. Westside serves Newcastle and Kent, as well as our migrant farm population. And Henrietta Johnson is in Wilmington. And these sites provide primary care in underserved areas, and we're working with them to prioritize getting vaccine to them to serve not just their direct patient population, but also to start providing more support for community vaccine as well. We also want to mention community vaccine, community sites, fixed community sites. We know that people want a reliable place to go where they know that, whether it's multiple times a week, every day of the week, that there is a site that they can rely on, tell their neighbors about. So we're planning to establish fixed vaccination sites, just like we did for fixed testing sites, that are in and easily accessible to underserved populations, especially for those who have trouble with transportation, trouble with traveling. Our state service centers are a possible location for some of these, but also possibly community organizations and community centers. We have previously mentioned as well that we're focused on getting vaccine to pharmacies in some of these underserved areas, as well as to physicians, medical providers who serve individuals in these underserved areas. We also are providing and are continue to expand upon rotating community sites using mobile buses and vaccinating teams. We're going to do more of administering vaccine in small scale pop-up style events. And this effort includes the visits that we've already begun in low-income senior housing in all 3 counties. We've vaccinated well over 600 Delawareans in low-income senior housing already. We and DPH are creating 5 teams to rotate around sites in the state to provide vaccination. Also partnering with CarePorts, as the governor showed the Vax machine. We're really excited about that mobile bus that's gonna have its first event tomorrow at Rose Hill Community Center. And thank you, Representative Franklin Cook, for your help and support with that event. But by the end of March, our goal is to have 4 of those CarePort MD buses to be able to be all around the community in Delaware. Curative, we've talked about Curative as well, and our partnership with Curative is going to continue, and we expect that to be a significant source of vaccinations, especially once supply opens up more so. We will continue to invite individuals from the waiting list to Curative sites, but we'll also work with community organizations, community leaders to help them fill up some slots at Curative sites. We'll set aside some slots so that they can help invite individuals in their communities directly to these Curative events. And then finally, some of our most successful efforts so far are from medical providers who can vaccinate and who are targeting underserved communities with those efforts. So we've spoken about the great work of the doctors at Delaware ENT and Allergy, Dr. Coker and Dr. Hochstein, who have done a great job serving some Wilmington communities. But also there have been great events by our hospital partners like Bay Health and BB and Tidal Health, St. Francis as well. And so with these partners, we're going to continue to make sure that they have vaccine supply so that they can help reach our underserved populations as well. So as I said, not everyone has the access, the transportation, the communication, the connections to be served by these larger scale vaccination events, but we must not leave these individuals behind. So we will continue to work with community organizations and trusted community leaders to reach individuals, because we know we won't get it done without these partnerships.
Dr. Rattay, I want to just jump in here to thank you and your team for this effort. Lisa, Henry, to thank legislative leaders who have, we've talked to the Lieutenant Governor, who's been on calls with throughout, going back to the spring with when we first started talking about outreach to the workers in our poultry industry in the lower part of our state, and really ramped up our testing. This is the vaccination equivalent of what we did on testing, and we're able to make sure that all those communities of colors got the kind of testing outreach necessary. And this is a similar thing. This, when we talk about fast and fair, this is the fair part of fast and fair, and it's a multi-tiered approach to getting vaccines into communities, making it accessible to as many people. Your public health teams that are getting out into the senior high rises, into more remote communities is incredibly important. The fixed community sites, again, I think important, again, based on the learning that we had on the testing side. Some of our community partners, including Kingswood, the LACC, as you mentioned, First State Community Action, the lower part of our state, and many throughout and across the state. You also mentioned Dr. Coker and Dr. Hochstein, their tremendous partnership, and other providers. Some of our pharmacies similarly are asked and directed to provide this kind of outreach, fair distribution. We are getting additional vaccines from the federal government, as I mentioned before, directly to Lared in terms of the FQHCs, which enables us to provide additional vaccines to Henrietta Johnson, as well as to Westside, which has reach in other parts of our state. And they're also giving additional allocation directly to some of the pharmacies in these communities. So a full effort to make sure that we can move those numbers and get a fast and fair distribution of the vaccine. Thanks for the work of your team in putting all of this together.
No, thank you, Governor. Thank you so much for your support and leadership on this. And as you said, we really, the input from our community partners and community leaders and legislators is just so incredibly valuable. Some of the other things that we have done, which is really important to make sure that we know that we're doing the right things to reach individuals, is a number of focus groups to ensure that we understand the perceptions among various communities around the vaccine and how we might be able to appeal to get them protected. Engagement is really important. We can't emphasize that enough. A number of regular calls have been going on, and really for quite some time, the Lieutenant Governor has been hosting calls with faith leaders, with Latin leaders, and with Black leaders in our community. And we're so grateful to her leadership and the relationships that have been built, and to be able to build upon that work to move this vaccine equity work forward. Data is really important, and this is something that's really important to the governor. He wants us to work hard at making sure that we're getting the best data possible to us and to you. We know that, when those who vaccinate, they submit reports, they don't always fill in the race and ethnicity data, and there's a variety of reasons for that, but we are working really hard to get the most complete data that we can through a variety of strategies, because it's very important that we have a full understanding of what our vaccine initiative looks like in our state to make sure we're reaching people as we should be. On the next slide, I want to really give a shout out to a lot of great people who've worked very hard on a multilingual toolkit. It's important that as we work to inform individuals and communities around the state about the importance of vaccine, that we know that we need to speak their language. We have a toolkit that's been shared with community organizations to educate their members about the vaccine. Printed materials include downloadable flyers and posters with information to reach those that we want to reach. Currently, we have materials in Arabic, in Chinese, in English, in Haitian Creole, in Spanish and Vietnamese, as well as materials designed to be the most readable for visually impaired. So we really, we hope that our community leaders, community organizations, please come check out our multilingual toolkit and use it to help us get information out. And if you see, opportunities for improvement, don't hesitate to let us know. Finally, I want to talk a little bit about some updated information released by the Centers for Disease Control and Prevention a couple of days ago about vaccine safety monitoring. We have two major sources for monitoring the side effects of these vaccines. There's one called VAERS, which healthcare providers for decades have been using to report any side effects. For this COVID vaccine initiative, there's something that the federal government created called vSafe as well. And hopefully those of you who've gotten vaccinated have downloaded it, and it provides you opportunities to share any side effects that you have via text. And so of almost 14 million doses administered so far, VAERS has shown almost a little bit shy of 7,000 adverse events, but it's important to mention that 90% of those are non-serious, just like soreness in the arm, aches, pains, that kind of thing. So only 9.2% were reported as potentially serious. Of those, 62 cases were severe allergic reactions or anaphylaxis, which really compared to any vaccine, this is really within the range of what we see as normal. Really is not a high number of serious allergic reactions. Of course, it's something we have to be prepared for. There were 113 deaths that were investigated to see if they might have been related to the vaccine. And among those, there was no relationship identified between the vaccine and these deaths. So really the serious reactions were those 62 cases of allergic reaction. On the next page, you'll see just some of the more frequent symptoms that people may express: headache, fatigue, dizziness. Injection site pain is relatively common. 70% of people say they get some soreness in their arms. So it's important to know to expect that. Headache, again, fatigue, not uncommon. And I do think it's really important to mention that we do see more people who have some of these side effects from the second dose compared to the first dose. In fact, although fever and chills weren't that common, they were 4 times more common in the second dose versus the first dose. So when you get your second dose, which is really important to do, just recognize that you may feel a little under the weather the day afterwards. And with that, I'm going to hand it back to you, Governor.
Thank you very much, Dr. Rattay. Special thanks again for your team working on community outreach, for engaging with legislative leaders, other local leaders, community groups, and trying to get, much like we have been doing with testing, where we've got testing numbers that far exceed what we originally expected. And AJ's here to talk to us a little bit more about that and some of the other things going on under his management, including some of these big vaccination clinics. AJ?
No, thank you, sir, and good afternoon, everybody. I'm out here today at the Speedway again with about 250 individuals, and these are individuals from, not only the federal government that's sending about 200 people to assist with the administration and the site setup, but individuals from Kent County. DelDOT's been a huge partner in making sure the logistics on scene has been working, as well as the public health staff, DEMA, Kent County Medic, St. Francis EMS, and really a big welcome to, or a big thank you to the host that's welcomed us with open arms, and that's the Speedway. They've been a partner with the state now really since the beginning of this pandemic with hosting monthly food bank drive-through events here, as well as also multiple regular testing events at the Speedway. So we couldn't do it without them, and can't do it without with like I said, 250 people that make this work for us to vaccinate 3,000 and 3,500 people a day. If you kind of look at the site layout again on the next slide, you can kind of see how big this is. We take this area that hundreds of thousands of people will come here for a race, and now we're using it to vaccinate 3,000 people. And we think we could even easily increase that number to 4,000 to 5,000 when the supply is there to support it. But kudos to the team from Del.gov, FEMA, and the public health staff that built this. It's the first one in the region. Kudos to public health Diane Hainsworth, who was the point person to facilitate the DMV pods across the state that really handheld these partners, because we're getting people from the Forestry Service, we're getting people from HHS that are coming here and work this and never worked an event like this before, and they used our job aid cards, they used the training, and really our successes and some of our hurdles as well over the last few months to make sure this is successful. Launched on Sunday, we did just under 1,500 people. We knew we wanted to ease into it, made sure everything worked well. I'll tell you, by noon Sunday, I think everybody was smiling around here because we know we hit a home run. Yesterday, a little bit more difficult of a day with the weather, but did just under 3,000 individuals. And if you saw the press release yesterday, I think on the next slide we have some information, and we got together yesterday morning to say, hey, this site, the capacity could handle more. We were able to identify some additional vaccine to use to really open up the window of those individuals that need their second dose. So you could go to de.gov/FEMA to sign up for a second dose appointment here through Friday. There's just probably about 3,800 spots available still. We opened up over 4,000 additional last night. And this is for anybody that was vaccinated with their first dose on or before January 22nd. So what we're trying to do right now is provide a location, center of the state, ample opportunities for the next few days for people to get their second dose. Come down here and get that second dose, and take that worrisome of trying to find someplace else to get it, because we know it's a supply and demand curve right now, and we want to take advantage of this efficiency that we have here and the support we have for the next few days. And that's regardless of where you got it. So you could have got it at a pharmacy or doctor's office, one of the DMV pods. If you got it before January 22nd, we'll provide that second dose through Friday. Sign up at de.gov/FEMA. Again, a drive-through event, I'll tell you, we're talking about the smiles we had Sunday and yesterday. After everybody shows up, everybody wants the 9 o'clock appointment. We'll have 100 cars here, by 8:15 or 8:30. Today they started at 8:35, rolling the first through. They did 100 people in probably about the first 30 minutes. After you get that first rush of people out here, people aren't waiting more than 15 minutes before they get seen at the injection site. There's multiple stages. There's a check-in, there's a screening, and then there's the administration and the observation. It's not uncommon. You're spending more time in the observation area, which is a 15-minute recommended period, or 30-minute period if somebody has a few underlying medical conditions. But you're spending more time in that observation period than you are in the queues waiting to get up there. So we built this, and like I said, we could definitely do a few more thousand a day once the vaccine supplies. So, we understand it's middle of state, take your time getting here. We don't expect there to be long lines. Stick to your appointment time as close as possible. We have people coming, hours early. There's no need to do that. If you come right around that time that your scheduled appointment is, that's what's going to make this operation run the smoothest, not just for you, but for those in front of you and behind you is their schedule as well. So again, we have over 3,000 appointments still available between now and Friday at 7 o'clock at night to get people their second dose. And I believe I'd go on a little testing overview. What's a week without me talking about testing? Again, I think last week I was telling you, hey, we went 49,000 to 41,000 because of weather. And then of course we had 2 bad days last week, and we lost some of the big sites that Newcastle County hosts just due to the weather event. So still able to build 34,000. If you think about it, we said we want to do 80,000 a month. We're still going to be well over that. Knock on wood, little minor impact yesterday from the weather, but the rest of this week looks good. So I expect us to be up into the mid-40s, if not higher, this time next week when we report out on this. But again, de.gov/get tested. We have the at-home process that's working great. We have the curative trailers, 4 of them around the state each day. Newcastle County hosts 6 different events, and very big events, Monday through Saturday usually. We have the fixed clinics with the state service centers, as well as still utilizing Walgreens. And that's on top of a lot of other medical offices that now have the ability to offer antigen or PCR testing. Next few slides we'll go through quickly, just shows you kind of where the pop-up sites will be over this week in Newcastle County and then Kent and Sussex. We still need people to get tested. We've had some great weeks of lower numbers, lower positivity, but we need to make sure people are still getting tested so we can identify it and do the, take the measures that are needed. So with that, Governor, I'm going to turn it back over to you.
Yeah, just a real godsend, the vaccination event there at Dover Downs. We appreciate the Speedway, de.gov personnel have been incredible. Of course, our federal partners. I met federal employees from the Forestry Service, you name it, to national parks. They came as far away as California, state of Washington, Montana. One was an EMT in Yellowstone National Park. We just had them from all over the country. And so we appreciate that partnership. It gives us an opportunity to get those second doses to the thousands of people that we gave a first dose to at the DMV clinics. We learned a lot from those DMV clinics. It was a bit painful at times. I apologized so many times to folks for the wait there. There's not a wait here, as you said, maybe 15 minutes on the front end, 15 minutes as you wait to make sure there's no negative reaction. It just runs so well and potentially gives us an opportunity in the future maybe to do something there. Certainly the outreach that we're doing, Dr. Rattay, into the communities is critically important. Our testing success shows me that we can do it. We can achieve fast and fair. We've got lots of ways to do that. So with that, we've got the media that are online. We've got time to answer some questions before we sign off.
All right, first we'll go to Amy Cherry with WDEL.
Thanks so much. Dr. Rattay, you mentioned getting over that second dose hump, and I'm wondering how close the state feels it is towards getting there and then getting back to vaccinating the rest of that waiting list on 1B.
Yeah, so that's a really great question. We vaccinated a lot of people in a 2-week period of time in January. So right now we are, in the midst of that second dose hump. By the end of this weekend, most of those individuals who came to any of our big events in January should have been able to find their second dose. So while second doses are, we're going to have to maintain people having access to second doses moving forward. We are going to be able to focus more of our allocation, much more of our allocation in the coming week than we did this week on first doses. And we are looking forward to getting back to offering more first doses to Delaware seniors.
Thank you. I'll yield my second question to Sean Green.
All right, next we'll go to Sean. Sean, you can unmute.
Dr. Rattay, all 3 Delaware college football teams, along with the DIAA Winter Sports, have their competitions over the next few days and weeks. What guidance is DPH providing to those schools on spectator limits, which have recently been raised in New Jersey and Pennsylvania?
Yeah, so this is a topic that we are looking into. For the most part, the NCAA guidance for college athletics has been good, has been solid, especially around their focus on testing and social distancing, mask wearing for athletes. But it is something that we are looking into to make sure that we as a state feel comfortable about the approach that's being taken.
All right, next we'll go to Nick Ciolino with Delaware Public Media.
Good afternoon. Governor, you mentioned earlier that there were, I believe you said 77,000 students back in classrooms statewide. Is there a sense at this time that kids have fallen behind at all over the time that they were under lockdown, and that the state has to take any action to allow kids to catch up?
Yeah, it's a great question, and it's a major focus. I know here in Delaware and across the country is to do some sort of assessment of how much ground students have lost, to determine what we need to do to get them back on pace. There's going to be a focus, I'm sure, on that remedial work. A lot of talk about getting support to students and families over the summertime. You may have heard President Biden talk about that in his town hall meeting a week or so ago, and it'll be a focus for us in terms of the resources that are coming to Delaware from the federal government to the schools and the school districts, and certainly that has to start with some sort of assessment as to where the children are in their progress.
All right, thank you.
All right, next we'll go to Tim Mastro with Delaware State News.
Hi, everyone. I'm sure you all remember in the fall during these really pushing the getting the flu vaccine kind of at the beginning of flu season. As we're kind of getting to the other side of the peak of flu season, what has the state seen? Did it live up to your expectations? And is there anything you can attribute to whether flu season was good or bad?
I'd just like to share an anecdote before Dr. Rattay talks about it from a medical basis. And that was in talking with the leadership at Nemours Children's Hospital. Their admissions for flu-related illnesses for children was way down this year. And the physician leaders there shared with me, they thought that it was because children weren't in school as much. They were wearing masks. There was a lot more protective measures that folks are taking, and therefore the admissions there at Nemours were down for children with illnesses related to the flu.
Yeah, and this has been the best flu season of my career by far. Every Friday I get our flu report, and most Fridays it's 0 cases. It has, an incredibly unusual flu season for us. Now we have had some flu seasons where our peak has been in March. So I'm still, holding my breath in hopes that we don't see a peak. But all the social distancing and the mask wearing that we are doing is clearly having an impact on spread of influenza. So, that is a silver lining or a positive of the mitigation strategies that the Delawareans are doing right now.
Okay. And one thing on the FEMA event, if you remember that Georgetown event, the DMV one had some issues that first couple of days with just the cold weather and computer problems and registration. We've been contacted by some people who said they weren't in the system despite receiving a shot there and wasn't able to register for the FEMA event. Is the state aware of this problem, and what should those people do to make sure they get their vaccine?
Dr. Rattay or AJ, do you have a?
Yeah, so I'll talk about that, Tim, and then see if Dr. Rattay has any answer. So, yeah, so there were some people that were never fully completed in the registration system we used back in January. And like you said, you hit the nail on the head. There's some computers that were freezing up, very cold out there. So when kind of overshifted on the fly decision to make sure we stayed in front of it to utilizing paper forms. If somebody was seen at one of the DMV events, they were honored to be here. We understand there's a few people that called the call center that might have received an email saying they weren't able to come to this one, and we told them if we were able to validate it when they got here with their card that had their location on it, we would honor and let them through. Now it's a little bit more of a moot point because we opened it up to people with an earlier date for anywhere across the state. So we were aware of that. We did get a few complaints through the email vaccination mailbox, but I think we've worked the way through it. And again, right now, actually relaxing it even more of who could come here over the next few days. Dr. Tay, anything else to add?
Nope. Thank you, AJ.
All right, last we'll go to Brendan Holbeck with the News Journal.
Good afternoon. Dr. Fauci has talked, off and on about how a lot of the mitigation measures that we've taken over the past year will need to continue during a lot of this vaccine rollout and perhaps afterwards. I know it's difficult to make predictions, but as you look ahead to the coming months and think about what Delaware could look like once a lot of the population has been vaccinated, what role do you think those mitigation measures like mask wearing and social distancing will play in Delawareans' everyday lives?
Dr. Rattay?
Yeah, so it's a really great question, Brandon, and one that we're often asking ourselves and we're being asked quite frequently. We have to follow the science, and we're waiting for more science to give us guidance on, when, if we can decrease some mitigation strategies for those who have been fully vaccinated. As you heard last week, those who've been fully vaccinated plus 2 weeks who've been exposed don't have to quarantine for the 90 days after their full vaccination. So, that was one step in that direction, but it's really important that we follow the science. We still have a relatively high level of COVID-19 in our community. And that means, if somebody who's been vaccinated might be transmitting it, which we just don't know from the science yet. Also, those who've been fully vaccinated, there is some potential that they may become infected. While we have high levels of COVID-19 in the community, now is not the time to decrease these mitigation strategies, but I think we're all looking forward to the day when we can, and when we can kind of reward those who've been vaccinated by, kind of giving them permission to let their guard down a little. We're just not there right now.
And my second question is on the topic of variant strains of COVID. How much genomic sequencing happens among the cases here in Delaware? And, is it at a level that you feel there's a good gauge of how widespread the strains are in Delaware?
Yeah, another great question. So our public health laboratory has the ability to do sequencing, and we do process about 2,000 COVID specimen in our lab every week. So we're sampling, I think, and I can verify this, but somewhere around 5 to 6% of those samples for genetic sequencing. So right now that's our surveillance approach. We also send a certain percentage of samples to the CDC as well. And so, we're certainly not able to look at all specimen right now, but through this surveillance strategy, we're getting a better understanding of how much of the variant spread we're seeing in our state.
Governor, that was the last question. We have no more questions.
Thank you very much, Haley, and thank you to members of the media for joining us today, for your great questions. And that's the last, Brandon's last couple of questions is a good place to end today. That we're not finished yet. We're making great progress from the after Thanksgiving, December holiday, New Year surge. We're on the other side of the peak, God willing. We haven't seen too much of the variant. We're worried, concerned about that. We're making progress, continued progress on testing, so we know better where we are. But we're 3 or 4 times the number of cases, the number of hospitalizations, where we were at the low point during the summer, and we want to be better than that so that we can, as we get more people vaccinated, we can reopen other sectors of our economy. We can live more normally. We can enjoy life more than we are now as we open up for spring and summer. There is continued light at the end of the tunnel. Our vaccination supply, our supply of vaccines continues to increase from the federal government. We're making progress with a plan to achieve our goals for equity and making sure that all Delawareans have access to this life-saving vaccine. And so things are looking up. We've got the possibility of a one-dose Johnson & Johnson vaccine coming in the days or weeks ahead, God willing. But we end our press conference today where we began, thinking about the families of family members who've passed away here in Delaware, the 1,379 Delawareans who succumbed to COVID-19, the 500,000 American citizens who succumbed to COVID-19 over the last year. It's a tremendous toll. We've been through a lot. We're going to get through this, but we pause today to remember those who've died, and we pray for their family and friends. Thanks for joining us today.